Syringes are necessary in hospitals for vaccinations or collecting blood samples. However, syringes also can cause cross-infection of blood-borne diseases, such as HIV and hepatitis, due to needle stick injuries or reuse of the syringes. Although a number of safety syringes have been developed to avoid these problems, they were not widely used due to inconvenience of use and high production costs. These safety syringes could not prevent needle stick injuries in recapping the needles, one of the main causes of the needle stick injuries. Number 1 cause in a survey of American hospitals. For these reasons, healthcare workers still have to recap syringes by using the one-handed technique, thus exposing themselves to the danger of infection. To solve these problems, the safety cap needle from Safer With uses advanced safety caps that can be applied to the existing types of syringes to lower the production costs, as well as prevent needle stick injuries when recapping the needles in the middle grip position. The safety cap syringe is also easy to use with just one hand and is safer to discard after use. Now let us show you how to use the safety cap syringe. First, firmly couple the safety cap needle to the syringe. Hold the middle of the safety cap needle with your thumb and index finger. Gently turn the safety cap to up and down mark, and then pull the safety cap down to expose the needles to draw vaccine or blood into the syringe. After filling the syringe if necessary, pull the safety cap up to cover the needle and turn it to safety position mark for the prevention of needle stick injury. The safety cap can be secured to protect the needle not only from external forces, but also safety accidents such as needle stick injuries. To inject a vaccine or take a blood sample, turn the safety cap to the up-down mark and pull it down again to expose the needle. After administration, pull the safety cap up and turn to the safety lock mark for reuse prevention and discard the safety cap syringe. Safer With has also developed the insulin-type safety cap needle. You can use the needle like a hypodermic safety cap needle for sharp injury prevention and reuse prevention to eliminate the danger of infection. Safer With has developed a variety of safety cap needles and achieved product simplification by adjusting revealed needle length by turning the safety cap. Therefore,
talk to you about our safety syringes. We have fixed and we have lure lock. And now I'll do a demo. And now let's review some important safety features of the Dynarex safety syringe. First, take the cap off, then pull up your medication and inject it. Simply pull back on the plunger and you'll see that the needle retracts into the syringe, and then snap off the plunger and dispose of this in a Dynarex Sharps container. For many more Dynarex products, please visit Dynarex.com.
Retrago is the auto-retractable safety syringe with a sharp injury protection feature, SIP, and a reuse prevention feature, RUP, which fully complies with the requirements of the Community Directive, and it is in line with the 2015 WHO Injection Safety Guidelines. Retrago is 100% safe. It has an automatic safety system which activates without removing the needle from the patient, preventing exposure to the contaminated needle. The needle is retracted and locked into the barrel of the syringe without any risk for the healthcare worker and for the patient. Retrago can't be reused. It has a built-in safety mechanism preventing reuse. After the injection, the plunger is locked into the barrel. Retrago is easy to use. It is a one-handed syringe and it doesn't require any training for healthcare workers. Retrago is cheap. The simple design and standard components allow for high quality and cost-effective manufacturing. Retrago is also pre-filled. Its patented self-locking mechanism and competitive price allow the use of Retrago also for low-cost pre-filled medications. Retrago supports safe sharp waste management. Its safety system blocks the needle into the plunger and eliminates the risk of needle stick injury also for waste management workers. Retrago is available in 4 sizes, 1, 3, 5 and 10 milliliters, and it's easy to use. Draw up the medication and push the plunger up until the air bubbles are removed, as you do with traditional syringes. Measure the medication dose using the plunger. Fully depress the plunger to inject the medication. Use your thumb to depress the plunger and put your fingers under the flanges to have a good grip. After injecting all the medication, further depressing the plunger, the needle is automatically retracted into the plunger while still in the patient. Now the needle is safe in the plunger and the syringe is safe for disposal. You can dispose Retrago in a sharps container in accordance with current legislation, without any risk for healthcare workers and waste management workers. Millions of people could be protected from infections acquired through unsafe injections if all healthcare programs switch to syringes that cannot be used more than once.
Remove the needle cover in a straight outward motion. Holding the catheter hub, rotate the barrel 360 degrees to loosen the seal. Make sure the push tab is facing upwards and the catheter is seated back in the notch. Stabilize the vessel and perform the venipuncture. Look for initial blood return along the catheter in 20 through 24 gauge catheters, then in the flash chamber behind the white button. In 18 gauge and larger, blood return will be only in the flash chamber. Once you see blood return, lower the catheter angle and advance the entire catheter and needle unit slightly. This ensures the catheter tip, and not just the needle tip, is within the lumen of the vessel. While stabilizing the vessel, push the catheter off the needle and into the vessel. Avoid pulling back on the needle. Release the tourniquet. While stabilizing the catheter hub, push the white button to retract the needle. It is not necessary to occlude the vessel. Blood flow will be restricted one time until a secure lure connection is made. Connect any accessory devices and flush or begin the infusion. Stabilize the catheter and apply a sterile dressing according to your policy.
System from the package, ensure the vent plug and needle-free connector are secure and the clamp is not engaged. Twist to remove the needle cover. Holding as shown, pull back on the white finger grips about 1/8 of an inch, then push them back together to their original position, making sure the colored platform and the white finger grips are snugly together. Stabilize the vessel and perform the cannulation. Blood is seen immediately in the catheter tubing once the needle penetrates the vessel. Lower the entire system and advance it slightly to ensure the catheter tip, and not just the needle tip, is within the vessel. Using the pad of your index finger behind the gray push tab, push the catheter forward into the vessel. Do not pull back on the white finger grips while pushing the catheter forward. Look for continuous blood flow up the extension tube to confirm the catheter tip is still within the vessel. Stabilize the system and shield the needle by pulling back on the white finger grips until the gray push tab component releases from the catheter system. Secure the catheter to the patient with a sterile, transparent dressing according to your policy. Make sure the catheter septum is covered by the dressing. Engage the clamp to keep blood from flowing out. Remove the vent plug and replace it with the needle-free connector included in the package. You may pre-attach your flush syringe for convenience. Release the clamp and flush until clear. A push-pause technique might be considered. To minimize the reflux of blood into the catheter tip, activate the clamp in accordance with the needle-free connector directions for use. To prevent accidental removal of the needle-free connector, hold on to it while removing the syringe.
V-catheter with passive safety technology. Safe and easy to use. resulting in first stick success. B. Braun's proprietary universal bevel on the Intercan Safety IV catheter is a super sharp needle that provides flexibility of insertion angles. The universal bevel creates a V-shaped tricuspid incision, resulting in a flexible pathway for easy and smooth catheter insertion. The result is less tearing and faster healing, greater comfort for clinicians and patients. Intercan Safety's double flashback technology improves first stick success through quick visualization of both the needle flash and the catheter flash. Here's how the double flashback technology delivers this benefit. Upon insertion, the first flashback of blood, needle flash, is visible in the clear flashback chamber, confirming the needle tip is in the vein. Using the push-off plate on the catheter hub, the catheter is advanced forward off the needle into the vein. A second flashback, catheter flash, occurs between the catheter and the needle, confirming that the catheter is successfully in the vein. Once the catheter is advanced completely, the needle is withdrawn in a swift continuous motion. The safety shield on the B. Braun Intercan Safety IV catheter engages as the needle tip passes through the catheter hub. It deploys automatically and permanently shields the needle tip. This safety feature cannot be bypassed and is designed to protect against needle stick injuries. The removable vented flash plug provides additional versatility to the Intercan Safety IV catheter. The flash plug can be replaced with a syringe or blood collection access device prior to insertion, or loosened to speed blood return during catheter insertion. After needle removal, this feature allows the clinician to obtain a droplet of blood for procedures such as monitoring glucose or hemoglobin levels. The B. Braun Intercan Safety IV catheter. Safe and easy to use, resulting in first stick success.
The vein is penetrated and blood return is observed along the catheter shaft and continuing to the flash chamber. The catheter is then advanced, and the button is pushed, retracting the needle into the barrel, where the needle is fully encapsulated. As the needle retracts, the blood control septum closes to stop blood from flowing out of the catheter hub. When a Luer connection is made, the septum is permanently opened, allowing flow into and out of the catheter.